when you hear people say, Democrats, even some Republicans in the Senate, are concerned about cuts to Medicaid, concerns about cuts to SNAP. Around 3 million people could lose food assistance from SNAP, and anywhere between 8 to 14 million Americans could lose health insurance over the next decade. So based on this bill, so when you see those ads, when you hear that from Democrats, what's your response as someone who spent hours negotiating this?
Yeah, and my response becomes take a look at the actual data. If you actually look at the spreadsheet, and I tried to do that last night, partially in the floor speech, is walk through the population statistics of where these benefits are going. And particularly in the Medicaid space, of when you have things like in Arizona, we had a $2.5 billion fraud of what we call sober living homes. When you actually take a look at one of the economic problems we have in the United States is there's close to 7 million prime age males missing from the labor force. And if you and this isn't conservative, liberal, it's actually just the data, is some of the incentives for that population not to participate in the economy is how we deliver these social services. And but there becomes the battle is one side will talk their book because they're being funded by the folks who make money off these programs, instead of the willingness to say, all right, here's our actual statistics, here's what we know are misalignment, here's actual fraud, and you have this list of, we've been actually building a list of actual frauds within the Medicaid system, let alone the work we're doing on the Medicare system. And then the incentives of how do you help our brothers and sisters, particularly brothers, participate in the economy again, because we all have the economic literature that says unless you're participating in the economy, you become poor because you don't develop the skill sets, you don't move up in your ability to make a living. Anyways, and I was pretty harsh about this last night in the floor speech, but you have the literature, it makes it clear we're hurting people by not expectation of participating back in the economy. But somehow that is a violation of someone else's economic model where they want as much population with the government subsidy. And then you actually have the three-legged stool of how many states use a provider tax to not actually meet their economic obligations in the system. So what's been so sad and frustrating is much of the discussion in regards to Medicaid has been completely void of how the system actually works, and also the differences in a state like Arizona where we buy managed care policies. We function by capitated policies for our indigent population, compared to a state like California, which is just the wild west of profligate spending. Should a state like Arizona be rewarded for doing certain things very well? And should other states that are off the charts in their spending and their cost be punished? That requires math. And right now the debate has very little math in it.
And so how, I guess, would be my next question, are you adding math into the conversation when it comes to the Senate? Because you've acknowledged this, Speaker Johnson has acknowledged this, everyone essentially has acknowledged that it is going to be changed. This bill is going to be changed in the Senate, and then will need to be passed again in the House. So what are your conversations looking like with Republican senators?
You're absolutely brilliant. One of the joys is I chair the Joint Economic Committee. So it's one of the few things in life where it's bicameral. You know, I have senators as part of the Joint Economic Committee, and it always annoys them when a House member is actually the chairman over them. And to the credit, there's been a handful of senators who've been using our staff, the Joint Economic staff, to try to understand how you maximize efficiency, how you make sure that the populations who need and deserve the services get them, but how do you remove the noise? And the noise is hundreds of billions of dollars if you actually read what's out there. There's also the other side. I've had a couple senators we've walked over our information to, and they've had very little interest. And the excuse is often, well, that's going to be too hard to explain to my voters. others who seem quite willing to do programs like you have, where this is one of the few formats left in DC where you can have an adult conversation of how to make things work. It's still to be seen what becomes an ascendancy in the Senate. Is it folks who actually want to manage debt and deficits by modernizing the delivery, or is it those who just, are afraid of someone throwing out numbers, even though those numbers are often self-serving to the folks that make money off